Very simply, for the creativity, it's hard. It's easy to take out a gallbladder or an appendix or treat high blood pressure. And those are very formulaic. You do it at the same time every time. But plastic surgery is unique and individual for every single patient. I never do the same operation twice. I do some of the same steps every time when I'm doing breast augmentation, for instance, but every breast is slightly, subtly different. And so in that becomes this challenge and responsibility to sort of pay attention, to really learn the anatomy and to learn some of the nuances that you see with different patients or that different patients bring to you. Another thing that's really important in plastic surgery is making sure that the patient understands the constraints of their own anatomy. I mean, that was a skill that took me a while to learn, and that's probably one of the reasons why we take a lot of before and after photographs. Patients never remember all of the subtleties of their anatomy that I am tuned into. And so afterwards, there will be many times that people will say, oh, well, what about this little fold here? It's always due to some anatomic issue that existed prior to surgery, not something that gets created by the surgeon. Surgeons are good at changing some things, but we're not gods. We don't create different parts of the anatomy that existed before we got started on patients.